Okay. Welcome, everybody. We're going to get started in about maybe like 2 or 3 minutes.
Hi, Matt. See some people I know.
Hey, Beth.
I see only a strip of people, and I don't know who's out to the sides.
All right, maybe just one more minute, and then we'll get started. Good morning, everybody.
Morning.
All right. Good morning, everyone. My name is Will Conley. I am the CEO of Park Center, which is a nonprofit that supports people who are recovering from mental distress and substance misuse. And I'm just really happy to be here with you all and grateful to be here with you and Beth Shinn this morning. Thanks so much for joining. This is the first, well, first, if you could mute your line if you haven't already, and we'll give some more kind of like housekeeping tips and stuff before we get started. But this is actually the first time that we've done a Park Center Pages event, and it's exciting to have Beth Shinn as our first guest for Park Center Pages, and we plan on doing more of these events in the future. So if you have suggestions on people that you want to talk to, please send those suggestions my way. But I just think it's really fitting and really humbling, actually, for me to spend some time with Beth and you this morning, because I've been interested in homelessness for a while and tried to be useful to communities that are trying to end homelessness. And Beth has supported me over the years and guided me over the years. Really, once she moved back to Nashville, which maybe was like, or not back to Nashville, but to Nashville, which was maybe, I don't know, 15 years ago, Beth?
13.
So, yeah, I mean, when you're interested in homelessness and then someone like Beth moves to your community, someone who studies homelessness and how to end it and prevent it, it's pretty awesome. And I haven't always felt like I've taken advantage of her knowledge, but when she wrote a book, like, I wanted to get a hold of it quickly, and I wanted people that I work with to hear about it and read it. And so that's why we're here today. And I just appreciate Beth for spending time with us, and thanks again to you all for joining us. Again, Beth studies homelessness, and she's worked on, she's crafted and co-led her own studies. One that she'll talk about is the family option study that many of you may know about, which is focused on different ways of ending family homelessness. She's also evaluated and studied the Pathways Housing First model, which is more about individuals than families. And then she's also worked on preventing homelessness and how to target the precious prevention resources that cities have. More than that, she's just been a community volunteer, which I've appreciated. She's made her time available to like point in time counts, and also the Homeless Planning Council and COC governance, and just really tried to plug in locally, even though she has a national and international influence as well. So all that to say, again, just thank you, Beth. Before I let Beth take over, we're a little housekeeping. So Beth is going to do a presentation. She's going to make a presentation, but she encouraged us, or does encourage us, to kind of raise our hands if we have questions in the middle of her presentation, because she wants this to be kind of a conversation. You can also wait until she's done and we'll do a Q&A. But Microsoft Teams has a hand raising function that you can use, and CF, Callahan, and I will monitor that. There's also a chat function if you want to chat questions in there. Again, please mute yourself if you're not talking. And what else I don't have to tell anyone about bathrooms or whatever. You're already close to that. What else? I want to just thank Susie Tolmie at MDHA for helping organize this, and also Judy Tackett at the Metro Homeless Impact Division, and also CF Callahan as well, who works with me at the center. So, all right, I probably missed some stuff, but thanks again, Beth, and it's all yours.
Okay, well, thank you so much for having me and for organizing this, Will, and for everybody else who contributed. As Will said, I co-wrote a book called In the Midst of Plenty, Homelessness and What to Do About It. And I'm hearing some...
you suggested,
Yeah, I'm going to work on that. Thanks.
I just keep going. And so I'd like to talk about it today, and then hope this can be a dialogue and we can have some opportunity to actually chat. So next slide. The book addresses 4 questions. Who becomes homeless? Next slide. Why? How do we end homelessness, and how do we prevent it? And we're having trouble getting through the slides.
Hey, sorry about that, Beth.
Yeah.
CF, are you CF, if you could do the slides, and I'll try to get this person muted. Again, if you could please mute your phone. That'd be great. Okay. Thanks.
So the first question is, who becomes homeless? Next slide. So on a single night, we go out and do point in time counts. We know we miss people, but we find over 500,000 people on a single night in January, both sheltered and unhoused, unsheltered. Over the course of a year, just considering people who show up in shelters, there are 3 times that many, 1.6 million. But it turns out that the way to get the highest numbers is to just call up people by telephone who live in conventional dwelling, ordinary apartments, no barracks, no jails, no homeless shelters, and ask them, have you ever been homeless? And in 1990, early in the current epidemic of homelessness, a researcher did that and found that 7% of the population said that they had been literally homeless, 14% if you count doubling up. Click. So most homelessness is temporary. Lots more people go through homelessness than are homeless at any particular point in time. And that gives us a lot of points of intervention. How do we prevent people from becoming homeless? How do we help people get out of it quickly? How do we stop them from returning? Next slide. So on a single night, from these point in time counts, about 1/3 of the people we find are out of doors, totally unsheltered. Another 1/3 are individuals who are unsheltered. And the last 1/3 is families, most of which, thankfully, are sheltered. Next slide. The age at which you are most likely to be in a homeless shelter in the United States is infancy. Infants are a blessing, but they're also costly. You know, they outgrow their clothes every time you turn around. They require Pampers. Most importantly, they take a parent out of the workforce to take care for that child, or require the parent to pay for somebody to care for that child. Homelessness drops when you get to public school age, and childcare expenses drop. It comes up again in early adulthood, though it never reaches as high as for infants, when some of those young adults are parents of some of those young children. Next slide, please. So when we think about the face of homelessness, we need to think not only about the guy on the left, but also about the child on the right. Next slide, please. Another important thing to know about homelessness is that African Americans and Native Americans are way overrepresented, even relative to their proportions in poverty. And we'll talk about some of the reasons for that. Next slide, please. So why do people become homeless? Next, please. My central argument is that homelessness is caused by a lack of affordable housing. And there are arguments here from history, from geography, and from intervention. Next slide, please. So here's the argument from history. Back in 1970, there was a slight surplus in the number of units available to people and affordable to people who were in the bottom quartile of the income distribution. But rents increased, incomes didn't keep up, inequality increased, and that surplus turned into a deeper and deeper deficit. And we began to see a new sort of homelessness on the streets, more young people, minorities, women, and families. Next slide, please. Next slide, yeah. So this is the amount you have to pay to afford a two-bedroom apartment in different states around the country, assuming, as HUD does, that you shouldn't spend any more than 30% of your income on rent. So Tennessee's around the middle here. You only have to pay $16.50 to afford a two-bedroom apartment on average across the state, more in places like Nashville, where the minimum wage is $7.25 an hour. Tennessee's about in the middle. There's some states that are better and some states that are actually much worse. Next slide, please. This shows the relationship between median rents along the bottom, and this is a little out of date, and the percentage of people found homeless in point-in-time counts. And you see a clear relationship here. If you click, please. The highest rent places are also the places with the highest homelessness. Now, there's a lot of affluence there, but because of income inequality, there's also a lot of poverty and a lot of people who can't find housing that they can afford. Next slide, please. So the last argument is from interventions. We find that rent subsidies prevent homelessness. So in a sample of families who are on welfare, on public assistance, providing a housing choice voucher that holds your rental expenses to 30% of your income, reduced homelessness over the next 4 years. And for families who actually used the voucher, who leased up, homelessness was reduced to 0. Next slide, please. So in addition to thinking about housing affordability, we need to think about why some people are especially vulnerable to homelessness. And I think that has to do with racism and some other forms of social exclusion. And there are 4 dimensions that are really important here: income, wealth, housing, and incarceration. Next slide, please. So with respect to income, Blacks earn less than whites. Over the last decades, Black unemployment has been twice as high as white unemployment on average. And this is not a difference in skills and experiences. So a study in which people sent out resumes to apply for jobs that randomly assigned white names like Emily or Greg, or putative Black names like Lakeisha or Jamal to those resumes, found that, and looked at callbacks where people called back for an interview. And they found that, click please, the difference between having a white name, the privilege of a white name compared to a black name on a resume was equivalent to 8 years of experience. So an enormous ongoing discrimination in employment. Next, please. Discrimination in wealth or wealth disparities are even greater than income disparities. So the median black household with a college degree has less wealth than the median white household with less than a high school diploma. The median white family is worth 13 times as much as the median black family. And because housing is the major form of wealth for poor people, that means that white families have housing resources that black families lack. Next slide, please. So this didn't just happen. This is a result of historical discrimination as well as present day discrimination that's not simply de facto, not simply people's prejudices, but also de jure, based in law. So there is discrimination in public housing from the beginning of the public housing program, with blacks shunted to inferior housing projects. The Federal Housing Administration declined to provide loans for housing to African Americans or even to whites in areas where that were integrated. And these color-coded maps that the FHA used to define the risky areas, risky meaning where blacks lived, are the origin of the term redlining. State and local governments got into the act too, with urban renewal, with zoning, with highways that cut through black business districts or cut black neighborhoods off from neighborhoods with jobs and opportunities. We've seen that in Nashville. In contemporary discrimination, those same kinds of experiments where a white family and a black family are sent out to apply for the same housing unit shows that discrimination is ongoing today, despite the fact that it's been illegal for years. Next slide, please. And then there are the differences in incarceration. US has the highest rate in the world, and black men are 7 times more likely than whites to be imprisoned, especially for drug crimes, although research suggests that whites and blacks use drugs at about the same level. Those incarceration rates, that high level of incarceration, takes fathers out of families, it takes earners out of communities. In 2015, 1 in 10 black children had a parent in prison or jail, and those kids are very likely to become homeless. Next slide, please. So I talk about social exclusion and not just racism because people with disabilities face parallel forms of social exclusion. Benefits levels are low, so low incomes, and to receive benefits for disability, you have to have a low income to begin with. There are restrictions in disability law on accumulation of wealth. The same kinds of paired tests show housing discrimination when a person with a disability and a person without a disability are sent to apply for the same housing unit, and there are high levels of incarceration. There are other forms of social exclusion, especially for young people. LGBT youth are often discriminated against. Sometimes that discrimination comes from their families. So we need to think about all the forms of social exclusion. Next, please. So how do we end homelessness? Next, please. The family options study kind of showed the way for families. This was a 12-site experiment that provides really strong evidence of the benefits of housing subsidies, those housing vouchers that reduce the rental cost to 30% of income. And those vouchers not only ended homelessness for families and reduced all forms of residential instability, but they also had radiating benefits for other aspects of family life. They reduced separation of children from parents. They reduced domestic violence and substance abuse and psychological distress. So things that sometimes cause homelessness are reduced when people have access to stable, affordable housing. They reduced food insecurity, they improved kids' school attendance, and reduced child behavior problems. And they did this all without any additional services. They provided a platform for families to get their lives together on their own or with the services available in their communities. As one mom put it, for me to actually have a nice house for our children without having to be completely worried about rent for this month, because my husband is trying to go back to school full time, and so am I. We know we're supported, and we don't have to worry about losing the house because we're trying to go to school and work, and we're safe, we're okay, and we'll get things back on track. Next slide, please. And I should say that also for families that transitional housing, the heavy-duty psychosocial service option in supervised settings, and rapid rehousing, subsidies that were short-term, in our study about 6 to 8 months on average, didn't do any better than usual care in the communities that we studied. For single individuals with serious mental illnesses and substance problems, they're going to need more than just housing, though they're also going to need affordable housing. So supportive housing, which is subsidized housing with services that are under people's control, ends homelessness for people with serious mental illnesses and substance problems. The traditional approach here is sometimes called the staircase model, in which people earn their way to more independent housing through sobriety and participation in treatment and treatment success. And like transitional housing that doesn't do much for families, this traditional approach can be called services first. The housing first approach bypasses these steps in the model and gives consumers immediate access to independent permanent housing without preconditions and with services that they choose. And there's really strong experimental evidence that this approach works much better than the old staircase model. Next slide, please. And we need to think about the homeless service system. Focused efforts with resources work. So the US made ending veteran homelessness a priority, and it devoted substantial resources, HUD-VASH vouchers, the supportive services for veterans' family services. And we nearly cut veteran homelessness in half as a result. Chronic homelessness went down in the United States as permanent supportive housing ramped up, though not to the level that it's needed. But families and non-veterans have not been a priority. Next, please. So how do we prevent homelessness? And there are two questions here. How do we prevent it for people on the brink? And how do we stop generating more? So next slide, please. Targeted prevention programs are programs for people on the brink. And there are two challenges here. One is to figure out what program is going to prevent people who would otherwise become homeless from becoming it. And the other challenge is getting the services to the right people. So it's not enough for a service provider to say, well, 90% of the people who had my program didn't become homeless. I can tell you how to get to 100%. Just give your services to millionaires. So bad targeting can masquerade as effective prevention programming. And the studies that have looked says no one is too risky to serve. Next slide, please. There are three kinds of programs that we have strong evidence for that we know prevent homelessness. The strongest is deep housing subsidies for families. I mentioned those before, those same housing choice vouchers that hold your housing costs to 30% of your income. Second program, New York City has a program called Home Base, which is essentially good old-fashioned social work with some cash backup. So connect people to all the benefits that they're available for, employment programs, child care, do mediation with whomever they're living with, get them on lists, and have a little bit of money for back rent or anything else that might be needed. It's not a very expensive program, so it's a modest program. It works modestly to prevent homelessness. And finally, cash help for eviction prevention. Now, most people who become evicted don't become homeless. In one study in Chicago, 2% of people who called up an eviction hotline became homeless in the next 6 months. And those who got cash help, that number was reduced to only 0.5%. So big reduction, but for a fairly low risk group to begin with. In every one of these studies, services had the greatest benefit for people who are at highest risk. Next slide, please. So there's some other strategies that may be just as good, but the research is not as good, so we don't know for sure. Legal help or mediation certainly prevents evictions. The question is whether it also goes on to prevent homelessness, since most people who get evicted don't become homeless. Shallow rent subsidies, that is ongoing subsidies, but less generous than the housing choice voucher, prevented homelessness for people with AIDS in one study. And universal screening was part of the effort that reduced homelessness for veterans. Every veteran who comes into the VA medical center for medical treatment gets screened once a year for housing instability. And if they screen positive for housing instability, they get referred on for prevention services. We can't really figure out what part of the decrease in veteran homelessness has to do with which of the programs, including prevention. And that's why I put that in the sort of moderate evidence category. Next, please. And then we have to stop generating homelessness. As we saw, a lot more people were homeless over a lifetime than are homeless at any particular point in time. Our society keeps generating homelessness, and we need to stop that if we're ever going to put an end to it. Because homelessness has to do with housing affordability, anything that reduces housing costs or increases incomes for people at the bottom is going to help. And we also need to combat social exclusion. Next slide, please. So there are lots of ways to reduce housing costs. The closest thing we have to a silver bullet would be a massive expansion of the Housing Choice Voucher Program. That might be on the agenda in Washington. There's certainly communities where we really need to create more housing. The National Housing Trust Fund and local versions of that, like the Barnes Fund, are one way to expand the housing stock. We need to create less expensive housing. Not everybody needs, 2 bedrooms, 2 baths, and a white picket fence. We need to think about models that cost less, particularly for single individuals that are still, decent, dignified housing. And we need to overturn exclusionary zoning that says you can only build, a single family home on a certain amount of acreage because that drives up housing costs. Next slide. Similarly, we need to increase incomes, and there are lots of ways to do that. We can raise the minimum wage. We can enhance the earned income tax credit. Right now, that goes largely to families with children. We could increase it. We could also make it more available to adults who don't have children. We need to broaden the social safety net. So SSI and SSDI benefits are too low to afford housing anywhere in the country. And we could raise those to a level that would support people with some dignity. We need to increase enrollment in programs like TANF and make childcare more widely available. And we need to reduce income volatility. So a lot of people are kind of hanging on until some crisis because of a health crisis or eviction or a job loss. They can't weather that crisis. So the sorts of things like universal health insurance or reform of unemployment benefits that would reduce that income volatility would also keep some people out of homelessness. Next slide, please. So then we need to combat social exclusion. One thing we could do is prohibit source of income discrimination. That's prohibiting a landlord from declining to take a tenant simply because the tenant is going to pay part of the rent with a voucher. We need to enforce the affirmatively furthering fair housing requirement. That was in the 1968 civil rights law. It took 50 years and a black president for HUD to finally issue the rules. And the next president came in and promptly put a kibosh on that program. That says that communities need to think about and develop a plan for affirmatively furthering fair housing in their communities. And we need to enforce that and go back to it. We need to enforce existing laws against discrimination. We do a whole lot better job monitoring discrimination than we do enforcing the laws that are against it. Next slide, please. So in sum, we know how to end homelessness. The evidence is incomplete, but we know enough. We know how to end homelessness for people who experience it. We have pretty good evidence on how to prevent homelessness for people on the brink. We know how to stop generating new homelessness. What it takes is political will. Homelessness is a choice, not by the people on the street, but by the rest of us when we look the other way. Next slide. So this is the book that expands on and gives the evidence behind all of the claims that I've made today. Next slide, please. And I'm happy to have a dialogue.
Thank you so much, Beth. All right. I know, like I said in the chat, I know many of you, fortunately, and I know that you all should have questions for Beth, because I've talked to you before and know maybe a little bit about what's swirling in your head. So please, please try to formulate some questions if you have them. We have about 20 or 30 minutes for Q&A, and you can unmute yourself. There's also a couple of questions in the chat that I can get to, but first, if I see Matt raising his hand, and then I'll go to Grace after that.
Thanks, Beth. I was wanting to ask a little bit more about the eviction prevention, as far as kind of the questions or assessments done to see kind of who is most likely to become homeless. I think the main question I've heard before is just asking if they've been homeless before. Mm-hmm. But could you offer, do you have an assessment or questions that help kind of identify who is most likely to become homeless, so we're targeting the right families or individuals?
Mm-hmm. So in New York City, we developed an instrument for them to assess who among these applicants for the home-based program was most likely to become homeless. But we had, a database of 11,000 applicants, and New York has a right to shelter, so shelter use is a pretty good proxy for homelessness in New York, and they have a really good homelessness management information system. And so we were able to look at who became homeless over the next 3 years and to build them a model. That model works for New York. We don't know what works here. The one question that, as you say, predicts in every study that is looked is previous homelessness. So people who've been homeless before are more likely to become homeless again. There's no study that fails on that. Low income, so people with middle incomes may be suffering right now. I don't deny that people are really anxious and really suffering. They're more likely to have resources that they can draw on themselves and their families. Racial minorities are at higher risk, and one way, one can simply say because of legal discrimination in the past, we owe more to folks of color now, and if that, in some jurisdictions that's seen as illegal, one can also look at neighborhoods and think about neighborhoods that are poorer and more at risk. So if people are coming from poor neighborhoods, they are more likely to become homeless. There's some geographic evidence for that. And that is one way of directing services to not entirely, but more to folks who are people of color who are demonstrably at higher risk. There are a few other things that matter for families. Having young kids is important. People who are, but mostly, it's just low income, low prospects for increasing income, disability, youth, and past homelessness. And I guess a couple of other groups, folks exiting foster care are at risk, not just immediately, but over the next, decade, probably because they don't have the social networks to draw on that middle class folks have, and folks exiting institutions are at higher risk.
Thanks, Matt. Thanks, Beth. And Matt, if you could figure out how to lower your hand, that'd be great. Grace Gadsden, Park Center employee. Grace, do you want to unmute yourself, or do you want me to? I can also just read your question in the chat, but I'd love to hear your voice if you don't mind. Okay, I can read Grace's question. So Grace says, using North Nashville as an example, could a system of assistance such as a quote-unquote handicap score, like in golf, to help close the gap in poverty, poor housing, and homelessness in the Black community? Didn't HUD try such a system in the late 60s and early 70s?
Well, you know more about that than I do, I think. And I'm not aware of the handicap kind of score, but we do need to put money into the communities that we have systematically taken money out of over the past decades to try to increase racial equity. And you know, each community is different, and I don't know where Nashville is in having an affirmatively furthering fair housing plan, but that's a community plan that says, let's look at our own situation and figure out how to do better. And thinking about what we need locally to try to promote businesses in Black communities, to try to promote employment, to try to make sure that minority businesses get a fair share of the resources that come down from government. And those are all really important kinds of things to be doing.
Thanks, Grace, and thanks, Beth. All right, I'll get Ashley's next, but before we get to her, Susie told me, asked if we can access the recording later, and we'll definitely send out the recording of this conversation to folks who have registered. And also, Susie, you can send it out to the listserv that you manage, as long as Beth is okay with that.
Sure.
Thanks, Beth. All right, Ashley Blum.
Hey, Beth, good to see you. I'm curious if you had or have received any data on how street medicine has impacted housing, like taking treatment to people in encampments.
I'm sure it's impacted health. I'm sure it helps people's health. Whether it helps people to get into housing, I suspect you need housing resources to get people into housing. So I'm inclined to, I think housing has radiating benefits. It's possible medicine has radiating benefits too, in the sense that if you're healthy, you're more likely to be able to find a job or to apply for benefits that you need. So everything's intertwined. But I don't think street medicine can overcome the lack of resources in the housing system. It doesn't make housing cheaper, and its chances of raising incomes to the level that people need to be able to afford housing is not great. It's not to say it's not important. It is important, but it doesn't get people housed.
Right, and through your research, have you seen other programs like in New York or other places that it was present in those certain programs by chance?
Have I seen programs in New York or elsewhere where, I'm sorry?
Just that have provided street medicine as part of their initiatives?
Well, the National Healthcare for the Homeless Council, which is located here in Nashville, has supports programs across the country for healthcare for people who experience homelessness, which includes street medicine. Perhaps the premier example might be Boston, which has been doing it for a long time. Jen O'Connell up there. Out in San Francisco, Margot Cushell has been doing work there. So people are certainly working in that arena, and it's important. For people who are in shelters, it would probably be more important to hook them up to a permanent source of care rather than to provide kind of specialized care. I can say more there, but let me see if there are other issues.
Thanks, Ashley, and thanks, Beth. All right, Phil Suter in the chat raised a question that I had on my mind too. How do we increase housing vouchers? I guess deep housing subsidies.
We lobby. that is, there is some money coming down from Washington now. There's a one-time increase in housing vouchers that we need to make use of, and the stock of housing vouchers is increased only from about 2 million to about 2.2 million over the last, I think, 20 years. Hasn't even kept up with inflation, much less with the increase in income inequality. And so that's really something that Congress has to appropriate, and we need to be lobbying our congressional representatives. That's challenging in Tennessee.
Thanks, Phil. All right. Well, Matt asked a question that I know you'll like, Beth. It's like, how do we buy your book in bulk? That was, it's on Amazon. I'm not sure about the bulk question though. I'm sure you can reach out to Beth and see if, offline.
I don't actually know about the bulk issue. I mean, we could ask Wiley, but it is on Amazon. And if you like it, review us there. How's that feel?
That was smooth. All right. Kaylee Shepard asked in the chat, she says, this may not be a question for this conversation, but can you briefly speak to how real estate and commercial development and gentrification, in parentheses, leads to homelessness?
Mm-hmm. Well, it's part of the ways that income inequality breeds homelessness. That is, it's not just, when we think about income inequality, it's not just that people at the bottom can't afford housing, it's that people at the top have alternative uses for that land. So the SRO hotel, single room occupancy hotel, gets replaced by a luxury condo. We have the golf course. The zoning in this country has gone in the wrong direction over the last half century. So it's become more and more difficult to find sites for apartment buildings and low-income housing. And so we need to think about zoning. We need to think about relaxing zoning, especially near transit, so that we can build multifamily housing there. We need to permit accessory dwelling units, granny apartments everywhere, not for Airbnbs, but for permanent housing. And we need to think about nonprofit and protected forms of land, community land trusts and the like. Now, those will mostly affect people who are a little bit higher on the income ladder than the folks that I'm most concerned about, and people who can, buy an affordable house, as opposed to people who can barely make the rent. But all of those are important, and I'm not against any kind of building of housing. The theory is that housing will filter down. So you build a unit that is above market at one point in time, and 20 years later, it will have be less attractive and will be affordable further down the income ladder. But when you're building McMansions, they are never going to filter down to people who are poor. They do, to the extent that there are people living in those McMansions, they're not competing with people in sort of the middle class for housing, and then the people in the middle class aren't competing with the people a little bit lower down in the income ladder. So we need most of our production at the bottom. We need things like community land trusts. Gentrification, some people say that's the only way you get residential integration in this country, but we need to protect the people who are there. It's a really complex thing, and I'm not a housing economist, so I'm not the best person to talk about those strategies. We're talking about them now in the Affordable Housing Task Force that the mayor has appointed. And, this is one of many task forces. I'm the triumph of optimism over experience. Maybe this one will get us somewhere.
Thank you for that.
Thanks, Kayla. There's a fire alarm test happening in the building that I'm in, so I may have to you have to jump in a minute. But Susie, I wanted to give you an opportunity since you've chatted. You've sent in a few messages over chat, but I don't see a question necessarily. But just wanted to see if you wanted to speak to the VI SPDAT issue at all.
Hey, can you hear me okay?
Yep.
Hey, Beth, thank you so much for all these remarks and for writing the book. It's fascinating and wonderful to hear the points that you've made this morning. Yeah, it just sounds like this VI SPDAT, which is the Vulnerability Index and Service Prioritization Instrument or something, that's been used for years here in Nashville and across the country to try and prioritize vulnerability for access to housing and services, is going to be maybe not even revamped. It might just sort of be kind of thrown in the trash. And there is a need to develop another tool to prioritize the most vulnerable in Nashville. And I'm just wondering if there are any ideas. And you were going over a few of the points earlier, Beth, about how to make sure that the people who need the housing and services most are the ones that get to the top of the list for those limited resources. And there is movement afoot to within the we call it the core group of an equity demo that Nashville was a part of with 8 other cities across the country to try and reduce the number of single Black males who dominate more than they should the shelter and homeless services in Nashville. And yes, we can't be sort of illegal giving single Black males priority over others, but they do face barriers that perhaps could be addressed more in a tool like that. And just wanted to see if you had any. You were going over some of the items and some of the, I guess, criteria that could be used in a tool that gets developed locally to give them a leg up, which I believe is needed in order for them to access the housing and to have more successful exits in the future.
Mm-hmm. Yeah, so researchers have nothing good to say about the VI SPDAT. It's not very reliable. That is, if you give the instrument to the same person, a month apart, you'll get different scores. There's some recent evidence that white folks score a little bit higher, even though Black people are at generally higher risk of homelessness. But how you set priorities in the face of scarcity is a really difficult problem. If you have a clear criterion for what you want and you have good data, you can predict it. So in the case of prevention, the clear criterion in New York was shelter entry. And we had good data, we could predict shelter entry. And we could say, here are the risk factors. What's the criterion here? Is it if you're already homeless? I mean, the VI SPDAT is for people who are already homeless. Is it people who are likely to stay homeless longer? Is it people who are likely to be harmed more by homelessness? Is it people who are likely to return? And then there are values-based kinds of priorities. So as a country, we set a values-based priority for veterans. We said, we're going to put more money and resources into veterans. And we could have other values-based. We could say, because of systematic discrimination against Africans Americans and Native Americans, a value-based approach would give more resources there. We could say, let's look at for families, let's look at the age of the youngest child. Kids shouldn't start their life in shelter. And for all of these values-based things, we can come up with some evidence. It's kids who start their lives in shelter don't have really good health outcomes. Maybe we, at the other end of life for single adults, the values-based would be the oldest people. Or maybe it's the people who've been homeless the longest. So you have to really decide kind of what the values are that you want to promote. And you have to think about what the outcome is that you want to prevent. And the people who are most likely to return to homelessness and the people who are most likely to die on the streets may be different groups of people. And so The VI SPDAT came in with this instrument that was partly based on kind of some form of health vulnerability, and communities latched onto it because they needed something, and I'd asked them to do something. And what's the alternative? There's a meeting of researchers almost a decade ago with the VI SPDAT people, and the researchers were saying, so is there any evidence here? Give us some evidence. And the VI SPDAT people said, well, the horses left the barn. We got it. Go ahead and complain. But I think it's a really difficult philosophical problem to say, what is it that you're trying to accomplish when you ration under conditions of scarcity? And nobody really wants to go back to, well, let's just let workers decide, because then the workers are more likely to give services to people who seem worthy by their own criteria, or maybe who look like them. They could imagine being that person, and so they give services to those people. And I mean, people who work in homeless services, they're the most wonderful people in the world, but we all have our internal biases and ways of looking at the world. I think there has to be a philosophical discussion about what it is we're trying to accomplish with an instrument, and then we can come up with the instrument. And when Matt asked earlier about prevention, we could think about, well, what you're trying to do, the criterion is a little clearer. You're trying to stop people from becoming homeless. So now I have an outcome. Now I can begin to tell you what to do for that outcome.
Thank you, Susie. Thanks, Beth. All right, we've got just a few more minutes, and the chat box is pretty active. So I hope I don't miss your questions. I had one that I just kind of want to throw in. I think it might be quick, but Beth, in your book, you mentioned that it's hard to argue that rapid rehousing is like an unmitigated success, and you mentioned it a little bit in your presentation today. How do you feel about the recent investment by HUD in rapid rehousing, especially in the last in the CARES Act, I guess, or in the last year or so? Yeah, I guess that's it. Just how do you feel about it?
Mm-hmm. Okay. So I'm terrified what's going to happen at the other end when those subsidies run out. And we should be getting people onto vouchers now when there's availability of vouchers to the extent that we can. I mean, rapid rehousing is no worse than shelter, and it's cheaper than shelter. So it's on those grounds a better use of our resources than putting people in homeless shelters. But there's no evidence that it has benefits the way housing choice vouchers have for any other aspects of family life. It might work better for kind of single individuals who might be more able to up their incomes to the point that they can afford housing. They need less expensive housing during the period of a rapid rehousing subsidy. The research that supports rapid rehousing is basically of the form, people who get rapid rehousing mostly don't come back to the same homeless service system. Well, people who leave shelters mostly don't come back to the same homeless service system. And we don't know that they don't come back to the VA system or the domestic violence system or the continuum of care next door to the one where they started. And when you actually go to try to follow people up, you find that it's hard to follow people up because they're not in the same place anymore. They've likely moved. And if they're, in the case of families and family options, we did follow people up, and they were largely, doubled up with other people. They weren't stable. Now, HUD says the homeless service system should resolve homelessness. It should get people out of homelessness. If it gets people into doubled up situations, that's a victory because they're not on the streets. Department of Education says they're still homeless. There's, I think it's important to be clear-eyed about what rapid rehousing does and what it doesn't do. It's better than shelter. There's nothing much else to recommend it. And it's better than shelter mostly because it's cheaper. So you can serve more people.
Thanks, Beth. All right, we've got about 5 minutes. One question was basically, do fewer zoning restrictions lead to lower rates of homelessness? And I think that was kind of back to around the time you fielded Kaylee's question about gentrification. So just wanted to, that was from the chat.
So I don't have evidence there. It's indirect, and I'm talking about fewer zoning restrictions mainly as a way of making housing more affordable, and housing being more affordable leads to lower levels of homelessness. So there's a train there, but I don't have direct evidence that changing zoning is going to reduce homelessness. But it does seem clear that exclusionary zoning can drive up the costs of building housing. And we need to bring down the costs of building housing because we have a housing shortage that's most severe, it's only severe really at the bottom of the income distribution. You know, the planning department shows where our shortages are, and almost all of them are for people below 30% of area median, which is around the poverty rate. And you know, there's a little bit of a shortage up to 50%, between 30% and 50% of area median, but not very big. And above 50% of area median, there isn't a shortage at all. So anything we can do that makes housing cheaper to build at the bottom will help. But the evidence there is indirect.
Thanks, Beth. All right. Might have time for one more. Anyone have a burning one there? I know one person that might, but. David Langelmartin.
Is mine the hand you were looking for?
Yeah.
I have several questions, but I'll just keep it to one. So I was thinking about the voucher conversation from earlier and thinking about all the times that I've hoped that more landlords would decide to accept vouchers, and just knowing that's never going to happen voluntarily, nor should we expect landlord schmoozers to be able to solve the problem at its current scale, where you have 50%, up to 50% of vouchers going unleased. So my question is back to your presentation, talking about adding income source to the housing non-discrimination policy so that landlords can no longer refuse to rent to someone just because they happen to pay a portion of their rent with a voucher. I know Chicago and some other cities have done this. Do you know if those efforts have been successful?
The Urban Institute looked at discrimination against voucher holders and found it was easier to lease up in areas with source of income discrimination. Now, easier to lease up meant, I'm making the numbers up, but they were humongous. You know, like 30 calls instead of 60 calls to get a place. It's still not easy to find a place, but it is easier in areas with source of income discrimination legislation. So.
All right, thanks, David, and thanks so much, Beth. We're at time now. We're at an hour, and want to respect your time and everyone else's. So just thank you again so much. This is an incredibly rich discussion. Thanks for all who chatted questions and asked them directly to Beth. We will send out the recording of this to all of you, and also just encourage you to order her book if you haven't already. It's called In the Midst of Plenty. And I look forward to seeing you, Beth, soon at the next community meeting, and I hope you have a great rest of the day.
And thanks so much for having me. Really appreciate the chance to chat with you. If you have a question that didn't get answered or one comes up, beth.shinn@vanderbilt.edu, 2 N's in Shinn. Happy to field questions in the future, but thank you. And thanks to Will and to the Park Center and CF for putting this on.
Great, thanks, Beth. All right, take care, everybody.